Hi guys, this is Mark Flener, and I am a fellow classmate colleague of yours in Nursing 652, and what a great opportunity to be able to introduce myself and talk a little bit about my life as well as my career and as far as my goals as a nurse educator. First of all, this weekend is a big weekend for me as I will be celebrating my 50th birthday. And not only as a mile marker birthday for me, but this is also a big celebration because a goal of mine was to be able to um, have my MSN by the age of 50. So definitely a lot of things to celebrate at this time. So in 2008, I started my ADN program where I graduated in 2010. Upon completion of my RN license, I went to work as a PACU nurse, where I did that for about 5 years and really started to kind of build upon critical care nursing and got my critical care certification and really wanted to kind of expand my knowledge and the level of patient care um, experiences. So I decided to move to Lexington, Kentucky, where I work at the University of Kentucky as a trauma surgical ICU nurse. So in our unit, we are level 1 trauma, so I've seen some extensive trauma injuries, as well as we get advanced surgical care such as transplants, and as well as we also are the burn center, so some very serious burns. But all those experiences have allowed me to kind of elevate my level of care, as well as be able to have these experiences to go forward in my educator role and to be able to share those with my student. Probably the first opportunity I got to really kind of think about my role beyond bedside nursing was really my last semester of my ADN program. The director of the School of Nursing at that time came to me and said, you know, we really kind of wanted to consider you as kind of an official tutor, mentor for the school, particularly for the third, second, and first semester students. And first of all, it was really a great honor that someone, I guess, maybe saw maybe the potential in me as an educator. But you know, the first opportunity I got to sit down with a student and kind of mentor them, and just kind of really opened this door for me and really started to develop this passion um, to be a nurse educator. But you know, once I graduated and really started kind of focusing again back on bedside care, really trying to kind of mold myself in my own nursing abilities, it was until about probably the second year um, as a bedside nurse that I really started again considering nursing education, was asked to be a preceptor, and then some of the nurses had there in my unit started to recommend me to the nursing school, to Western Kentucky University, that was part of our hospital, as a potential clinical instructor. So I've been doing that now for about 2.5 years, and it just kind of really just took this initial passion and desire I had and just really kind of set it on fire for me, and really has been a big part of my driving force to be a nurse educator and to really go after my MSN role. I think probably for many of us now that we're kind of coming close to the end of our program, that we're really probably looking ahead and trying to think about, you know, what kind of educator and how we see ourselves in that role. And, you know, I kind of look back on my clinical instructor experience, and I've started to really kind of learn that my job is really not to teach. And I think a big aha moment in our reading that we just did is when Ken Bain said that sometimes the best teachers teach with their mouths shut. And I really have kind of learned that many students have their own potential and they have their own capabilities to be a great nurse. And I think sometimes the educator role is just to help guide them to see that potential, and then just to make sure that every obstacle is out of their way and that they have every opportunity and the right environment to learn and to be able to seek out their own individual potential. And so, I really see myself in my educator role as not somebody that's kind of in front of the class, but somebody that's more to the side. It's really kind of just cheering and coaching them on to really be able to see, their own visions become reality. So I just want to wish everybody a great summer and a continuing of your journey. And I look forward to spending quality time with you all in July when we get to meet there at Gonzaga and Spokane. Everybody take care. Bye.